Okay, and we're back. This is Nursing with Hart PhD. Check out my YouTube channel. It's at Dr. Hart PhD. And here are some practice questions. These are NCLEX-style practice questions on the older adult. A couple of them directly correlate with the material that I covered on the mental health assessment of the older adult. So I thought those were good. So let's look at these test questions. Okay, number 1. When the home care nurse visits a family client aged 78 years who is recently widowed, the nurse finds that the home is cluttered with trash. The client appears sad and disheveled. The nurse should assess the client for symptoms of which one? So, when your client appears sad and disheveled, disheveled is when the person is not taking care of their personal hygiene. Their hair is messed up, the hair not taking a bath, not showering, they're not brushing their teeth, and they're not taking care of the basic ADLs or activities of daily living. Okay, so here are the answer choices. Letter A is fatigue, B is presbyopia, C is drug overdose, and D is depression. And I'll give you a minute to think about these and think about what you think might be the correct answer. Let me take a minute to encourage you, if you're enjoying this content, to like, share, and subscribe to my YouTube channel, which is Nursing with Hart PhD. I have about 8 years in the mental health nursing field and 5 years in teaching nursing education. Okay, so we're back, and the correct answer on this one is letter D, depression. So someone who is obviously appearing sad and disheveled, okay, is going to be, these are signs of being depressed. So symptoms of depression include poor cognitive performance, sleep problems, lack of initiative. And I will cover a chapter on depression, and that will go more into detail about the signs and symptoms of depression. The other answer choices A, B, and C. There's nothing in the stem of the question that indicates any of those things are showing up in the stem of the question for this client. Okay, next question. The older adult client informs the nurse, I just don't feel like myself. I cry so easily and my mobility is so bad from my degenerative disc disease in my back. What factor is most likely contributing to the client's depression? And so this kind of covers the mental health assessment of the older adult content that I covered in the previous video. I will put a link to that video at the end of this so that you can go back and review that material. Okay, so what factor is most likely contributing to this client's depression? Okay, answer choices. A is pain, B, shortness of breath, C, hearing loss, and D, diminished vision. All right, we'll give you a minute to think about it. Okay, and on this one, the correct answer is A, which is pain. So the client is telling you that they have poor mobility from the degenerative disc disease in the back. And so pain is what's contributing to the client's depression. Shortness of breath, the other choice is shortness of breath, hearing loss, and diminished vision. There's no indication that any of those things are going on from what you see in the stem of the question. So many factors place an older adult at risk for depression, including recent bereavement, and I talked about some bereavement in the content that I covered, a change in environment, alcohol or substance use, and chronic pain. Okay, so let's move on. Question 3. A nurse is teaching a group of older adults about aging and risks to health. The nurse determines that the teaching was successful when the group identifies which condition as a major cause of injury in the older adult. Okay, and your answer choices are A, depression, B, polypharmacy, C, falls, or D, dementia. We'll give you a minute to think about these answer choices. Okay, and on this one, what is the major cause of injury in the older adult? And that is C, falls. Okay, very, very important question. For people older than 65, falls are the leading cause of fatal and non-fatal injuries. Hip fractures are the most significant problem in the older adult, okay, because of the lack of with the bone loss, especially in females. Here's a statistic for you. According to the CDC, fall death rates in the U.S. have increased 30% from 2007 to 2016. And if this trend continues, we will have 7 fall deaths every hour by 2030. Many factors put the older adult at risk for falls, including medications affecting balance, thinking, memory, and elimination. So if they're struggling to get to the bathroom, right, in the hospital rooms especially, it's a strange environment. When you admit an older client, you should be orienting them to the room. Show them where the call bell is. Make sure they know where the TV remote is. Make sure they know where their cell phone is, because I guarantee you, when they're first admitted, that is what they're going to be looking for first, is their cell phone. Okay, and we don't want them to be getting up, especially if they're a fall risk, getting up and trying to get to the bathroom, climbing over side rails. Very, very dangerous. Also, thinking, memory, and elimination, impaired vision, environmental hazards, slippery floors, throw rugs. These are more in the home environment. Slippery floors, throw rugs, poor lighting, decreased strength, loss of bone mass. I mentioned that, especially in females, and neurologic and musculoskeletal problems. Okay. Next question. The hospice nurse is visiting the older adult wife of the client 4 weeks after the client died. So this is the wife of your client. Which comment by the wife would concern the hospice nurse the most? Okay. Which comment by the wife who's lost their spouse would concern the hospice nurse the most? So that is telling you it's a priority question, right? Which statement concerns you the most? Here are the answer choices. Letter A, I haven't started cleaning out my husband's closet yet. B, it is so hard to think that I won't see my husband again. C, sometimes I just sit and cry. And D, eating alone is so lonely, I just lose my appetite when I think about it. All right, we'll give you a minute on this one. Okay, on this one, this is a priority question. Okay, so you're thinking about what is the priority here over everything else. And in this case, it's the client's nutritional status. Okay, the answer D, eating alone is so lonely, I just lose my appetite when I think about it. So the psychosocial aspects of eating alone after the death of a spouse, they have no one to talk to, no one to interact with while they're eating. So eating it is not enjoyable anymore for them. Then this can lead to problems in maintaining adequate nutrition. Leaving the closet untouched, missing her husband, and crying 4 weeks after the loss, these are part of the normal grieving responses. All right, next one. A home care nurse is aware of the growing problem of the mistreatment of the older adult population. Which information would be most important for the nurse to keep in mind? Here's the word most again. Okay, and this is content that I covered in the previous lecture. There will be a link at the end of this video to that particular video that you can review. Okay, so the nurse should keep in mind what information when we're talking about the growing problem of mistreatment of the older adult population. Number one, letter A, dementia is a predisposing factor for abuse. B, statistics about abuse are easily available. C, the trend for reporting abuse is decreasing. D, older adult neglect is rarely self-inflicted. That's actually spelled wrong. It should be inflicted with an I. I-N-F-L-I-C-T-E-D. Okay? Okay, and we'll give you a minute for this question, and we'll come back. Okay, and in this one, the correct answer is A. Dementia is a predisposing factor for abuse. Dementia and frailty predispose an older adult to mistreatment. The problem of elder mistreatment or abuse is mostly hidden and is a growing problem. Therefore, it is hard to know how many people are suffering from abuse. The good news is that recent data from the Adult Protective Services, or APS, shows an increasing trend in the reporting of abuse, although there's still lots of work to be done. In order to increase awareness and reporting, neglect can be self-inflicted. Okay, so let's look at these other answer choices. Letter B, that says in the description that I read to you, statistics are not easily available because so many cases go unreported. And why did I say in my content that the older adult is less likely to report the abuse that they're going through? Is because they're embarrassed. They don't want to bring legal action, especially if it's the family. They're afraid they're going to have to leave their house. So they usually don't report abuse. Okay, and then the trend for reporting is decreasing. That's not true. It's actually increasing. Okay, and the last statement, the neglect can be self-inflicted. All right, and so that's it. So that's all we're going to cover for today. We'll see you on the next one. Have a great one.